Question 5 looks at the experiences of a specific group of cold Australians when they use health services, in this case Arabic Australians. In the Arabic community, particularly amongst Muslims, there is a big emphasis on modesty. In Arabic cultures, some parts of Western medicine can be seen as unbecoming. Muslim Australians particularly have been shown to be reluctant to share personal information, even with a doctor, often limiting a comprehensive diagnosis. Arabic Australians are also more likely to avoid health services due to a fear of being placed with a doctor of the opposite sex. Muslims tend to have a strong belief in the required prayers while ill or in labour, so that one study actually showed that Muslim women were only willing to access healthcare providers if they were able to accommodate these practices with, for instance, a dedicated prayer area. These kind of things can manifest as a health issue, as one study by the World Wellness Group found that Middle Eastern and North African Australians are hospitalised for chronic, potentially preventable conditions at a rate of 33% higher than their Australian-born counterparts. Further to this, a staggering rate of 350% higher hospitalisations is found for North African Australians due to vaccine-preventable conditions. These statistics show that Arabic Australians are not using Australia's primary healthcare system effectively. Mental health issues such as anxiety disorder and post-traumatic stress disorder are far more prevalent in Australians born in refugee source countries such as Iraq. Unfortunately, mental illness is stigmatized more so in Arabic cultures than in other cultures. As with other religions, the clergy is often the first place members of the community may turn to in a time of crisis. However, studies show that Arabic religious leaders are less likely to advise toward medications, particularly if they may cause addiction. These factors together have shown a higher mortality rate for Arabic Australians. The population have a greater need for health services, particularly mental health, yet have lower rates of surgical admissions, lower rates of total days in hospital, and particularly lower rates of admission due to mental or behavioural disorders. Question 6 looks at the similarities and differences between the health experiences of Indigenous Australians and Arabic Australians. As with Arabic Australians, Indigenous Australians are more likely to suffer health problems, particularly mental health issues. Regarding suicide, Close the Gap reports that the Indigenous suicide rate is about double that of the non-Indigenous population. Yet, as with Arabic Australians, Indigenous Australians are less likely to access health services, particularly regarding mental health. Similar factors reported between the two populations include long waiting lists, money factors, and language barriers. However, the greatest factor joining these two groups is a feeling of racism. Both populations are not only minorities, but are more likely to experience racism than other minority groups. 3 in 4 Indigenous Australians claim to experience regular racism, and between 25 and a quite staggering 44% of other Australians report negative or very negative attitudes towards immigrant Muslims, according to a report by the Scanlon Foundation in 2014. This lack of social cohesion is likely a major factor in the mental health issues that are prevalent, yet like a self-fulfilling prophecy, also causes these at-risk individuals to be less likely to access healthcare when in a real crisis, which furthers these serious conditions. Thank you.
So what can we do to respond to the social determinants to improve the health and well-being of Indigenous Australians? Well, lucky for you guys, we're one step ahead. Welcome to informme.com.au, an online community aimed at young Indigenous adults that provides a safe and secure environment so that they can gain access to information, services, phone numbers, and locations. Information. Knowledge is power. We aim to inform all that visit our website on current and relevant health issues, as well as other everyday issues that are relevant to specific areas and destinations of Australia. Services. We have services and links to services for specific health and living needs. Need to know where to go? Simply want to join a basketball team in your local community, or just want to talk to someone? We can help you. Stop on by. We also have prioritize health services on your area. So where you are in the country, we will have a list of services available for you. Phone numbers. We have an extensive list of phone numbers related to services and what information to help you with. Locations. We also provide a list of locations relevant to where you are in the country, such as hospitals, health facilities, community halls, community centres, list of activities, and many more. We also now have a secure and anonymous online forum and conversational chat 24 hours a day, 7 days a week, if you need that information right now. No time of day or night is a bad time to stop by informme.com.au. Join the community now.
These significance programs inform-me.com.au not only improve Indigenous Australian health, but it also a key strategy that can improve the Middle Easterners in Australia health well-being in many ways. It increases awareness and preparedness to engage with Middle Easterners in Australia, also develop more open attitudes and a better understanding toward their health issues. Furthermore, these contributions give important perspective and positive health experience for Middle Easterners. This program will also build connections for them and people with different backgrounds who live in Australia that will further develop their sense of health security and sense of belonging. It dispenses additional information on health service access, service quality, and most importantly, reduce discriminations and language barrier between the health practitioners and patients. This program gathers extra information on how to access to health service, the phone number, the locations, and which will assist Middle Easterner and the other cultural group livings and health needs. As Georges has mentioned, inform-me.com.au is a secure online forum, so everyone can participate anytime and privately. Although this program may work effectively on health improvement for the Middle Easterners in Australia and the Indigenous Australians, however, it sometimes does not work. Why? It's because not every cultural competency strategy is effective. 2. Cultural awareness cannot rapidly deliver within a short time frame. It requires knowledge and training in order to develop behavioral change before that with another culture. 3. Many programs still waiting to be developed and delivered in partnership between people in Australia and the Middle Eastern.